Today I'm going to show you some of the equipments we use when we have to intubate a baby. So a lot of premature babies, especially the micropreemie ones, and are having difficulty with breathing, might need intubation and a ventilator or breathing support. And a lot of babies also who are born not premature but also needs ventilator, then of course we have to intubate. Today I'm going to show you some of the equipments that we use to guide us. This, what I'm holding right now, is what we call a laryngoscope blade. It's a laryngoscope Miller blade. This is battery operated. It's kind of light, not too hefty. And we have sizing for this. For very preterm or very tiny babies, we use a 00, usually for 24 to 26 weekers, even tiny ones. We use a 00 to guide us. For preterms, bigger, then we use a 0, and for term babies, then we use a size 1 laryngoscope blade. This is attachable like this, and voila, you see the light. The light will show us when we look for the landmarks. When we're intubating, we look for the vocal cords and the glottis of the baby, and this light really is nifty when we have to look for those landmarks. This might look sharp, but really it's not. It's blunt. But we are still careful when we are intubating babies, just because, you know, when you use this, you might cause like injury in the mouth, gums, and even the trachea of the baby. Now, this is just the laryngoscope blade. This is what guides us. We also have what we call the endotracheal tube. It's plastic, and I don't know if you can see, but this is the top of the endotracheal tube, and here is the tip. We have sizing for this. Babies who are less than 1 kilo and 28 less than 28 weeks premature babies, we use a size 2.5 millimeters of endotracheal tube. Babies who are about 1 to 2 kilos, those babies who are 28 weeks to 34 weeks, then we use a 3.0, and bigger than that or older than 34 weeks, we use a 3.5. So these are just the things. And when we intubate, some people would use a stylet. It's like a wire, just to help us introduce the endotracheal tube. Some people would intubate without any need of stylet. Really, it's more of how comfortable you are when intubating with or without the stylet. I prefer to intubate with a stylet, but if the endotracheal tube is kind of stiff and I thought it would be hard enough to be placed inside, then I also don't use a stylet. When we intubate babies, we are very careful. The tip, even the stylet, if it's not properly placed, can cause injury in the baby's trachea, and also can cause injury in the bronchus of the baby. So when we're doing this procedure, everyone is careful, and this is just how we do it. So again, laryngoscope, endotracheal tube. Once the baby's intubated, then we hook them to a breathing machine or the ventilator. So just for you guys to be aware, this is what we use when we intubate your baby or babies in the NICU.